chapter 25, 26, and 27 for CNA lecture. On this one, I want you, again, when I'm lecturing on the computer and it's being projected up on the board, I would prefer that you go ahead and open these up on your own computer, on your own Chromebook at your desk, and follow along because that's going to help you with it quite a bit. All right, chapter 25, grooming. Grooming measures. So grooming measures are going to be very important to many people. They also prevent infection. We've talked about that a little bit before with bathing, and promote comfort as well. They also address the love and belonging and self-esteem needs on the hierarchy of needs as well. But people always differ in their grooming needs. The person should tend to their own grooming measures to the extent possible. So if they're able to do their grooming needs, then you should let them as much as they can or assist them with that. The person may also use adaptive devices for grooming as well. How they look and they feel of their hair also affects the mental well-being. You can assist with their hair care whenever it is needed, and the nursing process itself should reflect the patient's culture, their personal choice, their skin and scalp condition, their health history, and their self-care ability, how much they're able to help with their care. As far as skin and scalp conditions, hair care, slide 2 of 7. Alopecia means hair loss. Male pattern baldness also occurs with aging. Hair also thins in some women with aging as well. Other causes with hair or alopecia are going to include cancer treatments, skin disease, stress, poor nutrition, pregnancy, some drugs, and hormone changes. Hirsutism is excessive body hair. This can occur in men, women, and children from hereditary or abnormal amounts of male hormones. So testosterone is going to be the main one there. Also, dandruff is going to be the excessive amount of dry white flakes from the scalp. So basically dry skin in the scalp. Pediculosis is also the same word as lice, and lice is going to be the infestation of wingless insects. Pediculosis capitis is going to be the infestation of the scalp with lice, while pediculosis pubis is going to be the infestation of pubic hair with lice. Pediculosis corpus is going to be infestation of the body with lice. So those two together, basically. You should report any signs and symptoms of lice to the nurse immediately or at once. They might complain of a tickling feeling or something moving in their hair. It's going to be itchy, irritability from the patients. They're going to have sores on their head or body caused from the scratching and possibly a rash as well. Scabies. Scabies is going to be a skin disorder caused by a female mite. The female mite is going to burrow into the skin and lay eggs. The person then has a rash and intense itching. So they are super, super itchy with scabies. Scabies is going to be highly contagious. The patient at risk for those with scabies are going to be those living in crowded living settings and those with weakened immune systems as well. So below you're going to see a picture of lice and some of the areas that there are, and then there's a picture of scabies there as well. With brushing and combing hair, you should encourage the patients and residents to do their own hair care, but assist as needed. You need to provide hair care for those who cannot do so. It is much harder than you think for an elderly person to raise their arms above their head. So if they cannot do that, please assist them with that. The patient, though, still needs to choose how to brush, comb, and style their hair. Brushing and combing prevent tangled and matted hair with the patients. To brush and comb the hair, start at the scalp and then brush towards the end. Do not braid the patient's hair without the person's consent. Last year in clinical, we had a lady that asked for her hair to be braided almost every day, and my students just love that. So if we have a student that's good at braiding, that's fine, but she just wanted her hair braided every day at Pike County Memorial last year, and she was so, so sweet about it. Never cut hair, even if it's matted or tangled. Please take that to the nurse. There's also going to be special measures that are needed for curly, coarse, or dry hair. The patient's hair care practices and products are part of their care plan as well. With shampooing the patient's hair, many different factors affect the frequency, including the condition of the hair and scalp, the hairstyle, and the personal choice. If they tell you in the shower room that they don't want their hair washed because they just got it done at the beauty salon, then please make sure that their hair doesn't even get wet at all, because they spend a lot of money on that and time and so forth, and they usually don't shampoo or wet their hair every day. Shampoo the hair when the nurse tells you to for sure, and the nurse should tell you what method to use as well. So it all depends on the patient's condition, safety factors, and personal choice as well. Shampooing methods include during the shower or tub bath. Also, we can do it at the sink, on a stretcher, and even in a bed. The hair is then dried and styled as quickly as possible after the shampoo so that the patient are not cold. Check with the nurse before curling or rolling up hair first. Shaving. Many men shave for comfort and mental well-being. Many women shave their legs and their underarms. Some women may shave their facial hair or use other hair removal methods as well, like waxing, hair removal products, plucking, and threading. We are going to be using both a regular safety razor and an electric shaver, and you're going to see those at clinical sites, so you need to make sure and follow any agency policy for cleaning the electric shavers. Most of the time, these are going to be kept at the nursing care centers in the patient's room and on the charger there. But at the hospitals, they might have electric shavers, or they should have them somewhere, but they're going to be like one-time use as far as the blade, of course, and then cleaned in between and so forth. Safety razors are just going to be kind of what I think of as like a cheap razor, and we will be doing a lab with shaving, so don't get too discouraged with that. But safety razors are not going to be used for patients that have healing problems, or if they're on anticoagulants like Coumadin or something like that. The anticoagulant is going to be a blood thinner. Also, you should soften the beard before shaving, and I'm going to talk to you about how to do that. We mainly do that with hot washcloths or warm washcloths to the face while we're getting the rest of the materials ready. The mustaches and beards need daily care. You need to ask the patient how they typically groom their mustache or beard, or if they want to do it on their own. You should never trim a mustache or beard without the patient's consent as well. Nail and foot care. So nail and foot care prevent infection, injury, and odors. There are also hangnails, ingrown nails, and nails torn away from the skin that causes skin breaks. There's also long and broken nails that can scratch skin or snag clothing. Also with this are going to be dirty feet, socks, and stockings that harbor microbes and cause odors. Injuries from nail or long nails and so forth could be stubbing toes, stepping on sharp objects, being stepped on, or shoes that fit poorly. Also, a lot of our patients, have poor circulation, and this prolongs healing. So infections or foot injuries are very serious for the older patients and the patients with circulatory disorders. With trimming and clipping toenails, it can easily cause injuries, so we should never, ever clip toenails for sure. I'll just go ahead and tell you that. We have a foot care segment, and we're going to possibly work on that, but we do have to do nail care on hands for sure, and so forth. You can use the nail clippers to cut fingernails, but never use scissors, okay? Also, some agencies do not let nursing assistants cut or trim toenails, and please don't do that. I'm going ahead and telling you now, please don't do that at any of our facilities. It is not allowed. You may also need to help or assist the patient with changing their garments. You should follow these rules as you do so. You should provide for privacy, so things like pulling the curtain after you've shut the door, turning them kind of away from you while helping them. Encourage the patient to change their clothing as much as they can do on their own, but also let the patient choose what to wear. You should make sure that their garments and footwear are the correct size, and that remove clothing from the strong or good side first. Always then so you're removing it from the strong or good side first, and you're putting clothing on the weak side first. So putting clothing on the weak side, removing clothing from the strong side. Support the arm or leg when removing or putting on a garment as well. Oh, excuse me. When changing hospital gowns are usually going to be worn for IV therapy. Some agencies have special gowns for IV therapy that open along the sleeve, like most of them do, and close with ties or snaps or Velcro in the back. Sometimes standard gowns are used, but they typically just have a thing in the back. But otherwise, if they have an IV, you can undo the arm and undo the gown by just undoing buttons along the sleeve. If there's injury or paralysis with the patient, you should remove the gown again from the strong arm first. Support the weak arm while removing the gown, and then put the clean gown on the weak arm first and then on the strong arm. So this is going to be the last slide for Chapter 25, Grooming, and it talks about combing and brushing hair, shampooing the patient's hair in bed, shaving with a safety razor, shaving with an electric razor, giving nail and foot care. So we'll have several labs to do with those as well, and I promise you I will get you guys caught up with labs. Problem solving, I want you to think about this question here. A resident with dementia has long fingernails. Some are broken and have rough edges. As you begin nail care, the resident resists by pulling away and yelling at you. What do you do? Why is nail care important for this resident, and how might you provide care safely? So I want to tell you real quick that the first thing that you need to remember is that in this scenario, the patient has dementia. So you need to be gentle with them, talk to them gently. They might not remember that you just told them that you're going to do nail care 2 minutes before or in a minute before. So you might just need to consult the nurse, you need to consult the care plan, and make sure that you understand what is going on with the patient before the nail care. I'm going to go move my lecture to Chapter 26. Real quickly back to Chapter 25. You guys will see on my slideshow in Chapter 25, and an important video to watch would be the shaving ones at the end. So please go ahead and watch those as you guys watch this lecture today. So moving on now to Chapter 26. Chapter 26, CNA, is under dressing and undressing the patient. We've already talked about this quite a bit with the last chapter here. When changing garments, they often need to be changed in the morning or at bedtime. Also, after bathing, when they're wet or soiled, on admission or discharge, you should always worry about the affected side or the weak side of the body from any weakness or illness or injury. The unaffected side is going to be the strong side. So affected side is what's happened with the injury. The unaffected side is going to be the strong side of the body. You may need to assist with changing these garments, so provide for privacy again, encourage the patient to do as much as possible, let the person choose to wear, so on. So put the clothing on the weak side first, remove the clothing from the strong or good side first. So the next slide up here is going to be showing you some pictures of some dressing aids. So the first picture there, picture A, is going to be a button, so pulling on buttons onto a shirt. Picture B is a device that helping put the patient their socks on. And then picture C is like a boot heel that's helping get the patient remove the shoes. When you're changing hospital gowns, we just went through that as well with grooming, so make sure that they're gowns especially for IV therapy with the button down the side, and then some are just standard gowns with just the tie in the back. Also, this next slide here with the 4 pictures of moving the patients around and changing their garments, it is showing you an example that in the first picture here, the sides of the garment are brought from the back to the side of the person. The patient that side is weak is going to be right there in the red slashes. So the next picture here, this is showing you how to take a gown off with an IV pull, and that's very important to pay attention as well. You never are going to unhook, never ever ever are going to unhook an IV just because you need to change the patient clothing. So if you can't figure out how to get the gown off or something like that, then you need to go ask the nurse what you should do to get the patient's gown off, because there's an IV there, and the nurse can possibly come and unhook it, but it's still not a procedure that we necessarily want to do. All right, so this is going to be the last slide here of Chapter 26, dressing and undressing. And then the problem here is going to be 2 residents share a room. After dressing the patient, you notice the shirt belongs to the resident's roommate. What will you do? How could this have been prevented? So everything needs to be labeled for sure. You need to double check that before you do so. You're going to have to take that shirt off the resident and put it in the dirty laundry and find a different one. Then there is a video here at the end with dressing a resident with a weak arm. And then we are moving on to the last and final chapter this week, Chapter 27. CNA is going to be urinary needs. So you also need to watch that video at the end of Chapter 26 and then move forward now to Chapter 27, urinary needs. With urinary elimination, eliminating waste is a physical need. It's a have to for our bodies. So the urinary system removes waste products from the blood, and it maintains the body's water balance. This is going to be a picture of the urinary system. So of course the kidneys are up top. There's one on each side. There's an adrenal gland on top of that. That's your fight or flight response. Then it goes on down to your ureters, which deliver then the urine down to the bladder, and then go out through the opening of your body, which is the urethra. With normal urination, a healthy adult is going to produce about 1,500 or 1,500 mils or 3 pints of urine per day. Factors that affect urine production are going to include age, disease processes, amount and kinds of fluids that are ingested, dietary salt, body temperature and sweating, and then drugs as well. Frequency, so how often they're urinating, is going to be affected by the amount of fluid that's taken in, by any habits that they have, available toilet facilities as well, their activity, their work, and their illness that is going on with their body. I'm going to talk about next here on the third slide of chapter 27, third or fourth slide here. It has got a whole bunch of terms related to the urinary system. So we're going to start off with these, and these are very important for you to know. The first one is dysuria. So if dys is in front of something, then that means it's painful or difficult. So dysuria is going to be painful or difficult urination or burning on urination. Enuresis. Enuresis is going to be defined as involuntary loss or leakage of urine during sleep and bedwetting. Hematuria is going to be blood in the urine. Nocturia is frequent urination at night. Polyuria, poly meaning a lot, so this is an abnormally large amount of urine. Urinary frequency is going to be defined as they're voiding at frequent intervals, so pretty commonly. Urinary incontinence, this is going to be the involuntary loss or leakage of urine. Urinary retention is not being able to completely empty the bladder so that the patient has went to the bathroom and you think that they've released all their urine, but they really have not released it at all. Urinary urgency is going to be the need to void immediately or at once, and sometimes these patients have a lot of accidents because of that. With normal urination, slide 2 of 5 coming up here, normal urine is going to be a pale yellow, straw-colored, or amber. Okay? It really should be clear with no particles in it, and it should have a faint odor as well. You need to observe the urine for color, clarity, odor, amount, and particles in blood. You need to report any complaints of urgency, burning on urination, or painful or difficult urination as well. You should also make sure that you report any changes in color and concerns like that, or if there's a lot of particles in the urine, you might have to save a sample of that for them. Bedpans. So moving on here to the slide about normal urination 3 of 5. Bedpans are going to be used for patients that cannot get out of bed, women who are avoiding and for bowel movements as well, and men for bowel movements. Standard bedpans and fracture pans are going to be used. Fracture pans are going to be used with patients with cast, if they're in traction, if they have limited back movement, after a spinal cord injury, after a hip fracture, we use these a lot, and after hip replacement surgery. So you can see the standard bedpan is picture A there, and then the fracture pan, which is honestly just like a thinner version of A, okay? And we have an example of both in the lab. So there's a standard bedpan and pan in picture A, and a fracture bedpan in picture B. So this next slide here is showing you how to put the patient on the bedpan. So you have to roll the patient up on their side, put the hard plastic bedpan underneath them all the way, and then roll them back over onto it. You also need to make sure that the patient actually stays on that bedpan, okay? And this is very, very hard time for the patient. Then you cover them back up with a blanket, give them some privacy, because going to the bathroom on a bedpan can be extremely hard for a lot of patients, but I have to in this scenario. With normal urination, continuing slide 4 of 5 here, men are going to use urinals to void. The man stands if possible. Some have to sit on the side of the bed or lie on the bed to use urinals, but some men may need support when standing. And a lot of men, if you can help them stand there, then they are able to go easier than laying in the bed. You may also have to place and hold the urinal for some men. As embarrassing that sounds, it is definitely sometimes a have to. You should remind men to hang the urinals on the bed rails and signal after use so that we can empty those. And to not, though, place the urinals on the over-the-bed tables or the bedside stands where we eat our food. Patients that are unable to walk to the bathroom often use commodes, so that's going to be slide 5 of 5 with normal urination here. The commode is going to allow for the normal position for elimination. The commode has arms and a back to provide support and help prevent falls as well. Some commodes are going to be wheeled into the bathrooms and placed over top of the toilet, which is very nice for cleanup because there's not that much, but they are going to be useful for the patients that need support in this setting. The container is going to be removed if the commode is used with the toilet. Otherwise, it stays on there and then you need to clean it out afterwards. Also, if there are wheels that are on the commode, then you need to make sure that they are locked and positioned over the toilet or over the container. The next 2 slides here are going to be over urinary incontinence. So there are some basic types of incontinence. Stress incontinence is going to be the first one, and stress incontinence is where the urine leaks when exercise or certain movements cause pressure on the bladder. Urge incontinence is going to be when the urine is lost in response to a sudden urgent need to void, and the person just can't get to the toilet in time. An overflow incontinence means that they have a small amount of urine leaking from a full bladder. Functional incontinence means the person has bladder control, but they can't use the toilet in time. Like maybe they have complete bladder control, but maybe they are just got back from a procedure and we're trying to help them or something like that, and they just did not have time to make it. Reflex incontinence is going to be when urine is lost at a predictable intervals, like when a specific amount of urine is in the bladder. Mixed incontinence is going to be a combination of stress and urge incontinence. And then lastly here is going to be transient incontinence. And this is when it's going to be temporary or occasional incontinence that is reversed when the cause is treated. So if a patient is real sick and they're having incontinence, that doesn't mean that they're going to be incontinent the rest of their life. So if incontinence is a new problem for a patient, they've never done it before, then you should tell the nurse immediately. It could signal some big problems. The following may be needed. With urinary incontinence, you definitely need to look at their skin and do good skin care with them, and dry garments and linens need to be replaced if anything's wet at all. We need to promote normal urinary elimination patterns. We might have to do bladder training and catheters as well. Incontinence is also going to be linked to abuse, mistreatment, and neglect. So remember to be patient because incontinence is beyond the patient's control. Okay? If you're becoming short-tempered and impatient, please talk to the nurse immediately. The patient has the right to be free from abuse, mistreatment, and neglect. Okay? Applying incontinence products. So this is when I've talked to you before about calling the incontinence product, not calling it a diaper, but more calling it like a Depend, a Brief, a Tend, Depend, Brief, things like that. But please do not call it a diaper at the clinical spot because that really degrades the person's self-esteem and so forth. These products are all disposable. That means they are used once and then thrown away. They typically have 2 layers, like a waterproof layer and then a cotton layer. Excuse me. Fluids are going to pass through that first layer and then be absorbed by the lower layer. Many of these products do come in bariatric sizes, and I know sometimes, though, we run out of sizes and so forth, so that's a problem that we deal with often as well. With bladder training is going to be defined as control of urination, and so that's always going to be our goal, to be able to do that with a patient. The patient's going to use the toilet, the commode, the bedpan, or urinal at certain times. Then the rules for normal elimination needs to be followed. The normal position for urination is assumed if possible, so standing for men, setting for females. Privacy for bladder training is very important, and there are 4 different methods for this. There is bladder retraining, prompted voiding, habit training, and scheduled voiding, catheter clamping, and so forth. Okay, so bladder training really helps with a patient that's had a catheter for quite a long time. What we do is we clamp off their catheter in certain intervals, and that causes, again, where their bladder isn't just emptying all the time like it is freely able to do with a catheter, but it makes it where that bladder gets full and you need to feel that urge before, and then call the nurse and let them know that your catheter needs to be emptied. Next up is going to be pictures of those adult briefs and so forth. So please take a look at those. We're going to see those very, very common in the clinical sites. This is next picture then is showing you how to change an adult depend or adult brief. So rolling the patient back and forth basically. Getting underneath the patient is going to be how we do it. Some adult briefs rip down the sides. If it's one of those, then that's fine that we can do that. Remember, these are disposable. If they don't have straps on the sides, then most of them are going to rip down the sides, but just make sure that the patient's adult brief is actually dirty or soiled before you do that. These briefs cost the patients a ton of money, so also try not to overuse them because they have to pay for them themselves. Even if they're in a nursing care center, these things are very, very costly. So if they haven't went in them, soiled in them, then you will put them back on. Okay, if they're not dirty or wet, you are going to put them back on because they are so costly. Here with the problem solving, so the last slide on chapter 27, excuse me you guys, you're going to assist the patient onto the commode. The patient is very unsteady and cannot be left alone. The patient says, "I can't go if you stand there." What do you do now? How will you provide privacy and safe care? So you're going to hand them the call light. You're still going to stay in the room, but if you can go to the edge of the room, okay, if you can step away from them at all or turn around if you don't trust them to sit there by themselves, but please step to the side of the room or closest to the door if possible. Or if you can hand them the call light and you trust them sitting there, and then step outside the door, and when they hit the call light, you'll see the light above the door come on, and then you can go in there. A lot of people need privacy to go to the bathroom. It's just because we have privacy at home when we use the bathroom because we shut the door. So a lot of patients, it bothers them to not have that privacy. So I told you that was the last slide on chapter 27. There is another video, at least one video after this, and it is how to use a bedpan. There might be some subsequent videos. I please encourage you to watch these videos. They are very, very important for you to watch if you get anything from these lectures. So I need you to watch those videos as well on your own. You can play those on your Chromebook.